Okay, hemorrhoids are blood vessels that are present around the anus on the inside, and these blood vessels or cushions are very similar to what we have on our mouth. We have lips that are blood vessels, and they allow the stool to pass through, and they allow in lubricating the area with the glands in that area and preventing problems in that area. Infection and other stuff that can happen, the high blood flow in that area helps decrease that. So hemorrhoids are basically blood vessels inside the anus, and sometimes they get abnormally large, and that is when that becomes a disease process. And if you have symptomatic bleeding, the most likely cause of that is hemorrhoidal bleeding. And hemorrhoids are these abnormal blood vessels inside the anus that can bleed. Sometimes they can also present on the outside, and that is why we differentiate them into internal and external hemorrhoids. Hemorrhoids are very common. Approximately 20 million Americans have hemorrhoids, okay? That's a lot of people who will have hemorrhoids, or probably half the population at some time in their lives will develop a hemorrhoidal disease or hemorrhoidal issues or hemorrhoidal problems. So we will be seeing more of that as our population ages. We will be seeing more of it as we start to do more colonoscopies and screening treatments for our patients. Hemorrhoidal treatment ranges from doing nothing to the extreme, which would be an operation. And doing nothing means that you start them on a fiber diet and you give them various creams and suppositories and lubricants and emollients and other medications that may relieve some of the symptoms. What we have found now in the 21st century is that ligating the blood vessels in that area, which we used to do with the rubber band in the past, has advanced to this new technology that we are going to introduce at our hospital. This is called HET, hemorrhoid energy therapy. This is a single fire anoscopic treatment modality that basically in English means that it is a small tube that you insert inside the rectum while the patient is partially asleep or in a twilight zone, and we will be able to go all around the anus, capture those hemorrhoids that are in the middle, and press a button, and that will cause the hemorrhoids to collapse and the blood vessels in that area to seal. And if this is done correctly, then patients and their hemorrhoidal disease symptoms will go down and they will get better. This is a product that can be used on the majority of patients who have hemorrhoidal disease, because the majority of patients do not have severe or massive external and internal hemorrhoids, but they bleed and they are symptomatic and they suffer. So we are trying to decrease the suffering and pain and symptoms like bleeding for patients who are out there. And this device has the potential to do that.